Yeah. Hey guys, this is Dr. C with Healing Arts Physical Therapy. And today I got a request from a friend that he was stating that he was having some back problems, especially with his long commutes to his work. He said it's about an hour each way. And I got to thinking, yeah, that'll be a good video to inform you about back pain with long-term sitting, especially while driving, the influence that just sitting has on our spines, especially when we're driving. The guy he wanted this information so he could significantly lessen his back pain while he drives, and he wanted me to show him some exercises that he could do to help either prevent or reduce it or eliminate it. And then, come to think of it too, in the past I've had some back problems too with driving, and it can start in the back, and then it can start to radiate down into the hip, into the outside of the thigh, back of the leg, all the way down to the foot. Sometimes it can accompany, or numbness and tingling can accompany that pain as well. So the purpose of this video is to give you guys some helpful tips on keeping your back in the right position while you sit, decreasing that pain so your drives can be a lot more comfortable. So I know in the past I haven't seen too many patients where the primary cause of their back pain was because of sitting while driving for a long period of time. I have seen some people where they have office jobs, desk jobs, they're just sitting all day long, and that can be definitely a source of back problems. But I've had a lot of people that have either injured their back or just had repetitive issues and strains to their spine, and then they go and sit. They go take a long car ride to their to an event out of town or a vacation, and then they always come back to me saying their back was just flared up and they barely could handle that long car ride. So yeah, I thought this video would be very helpful, informative. I've seen a lot of people for this condition in the past, and so I want to relay some good, helpful information to you guys too. So far, I really appreciate you guys tuning into my videos, and personally, I'm enjoying doing these too. It's a lot of fun, and I hope you guys are really benefiting from it. And I look forward to doing many more of these videos in the future. And to let you know, I also have a YouTube channel, so you can view any of these videos that I've done in the past at Healing Arts Physical Therapy YouTube channel. So anything I put onto my Facebook site is also going to go to that YouTube channel. So yeah, from here on out, I'm just going to show you, anatomy of the spine, how to sit, how not to sit, and show you guys some exercises. Hope you enjoy. Thanks. Okay, so I want to show you guys how to sit incorrectly and how to sit correctly. So the correct way will obviously be the way to reduce back pain and keep your spine in a more stable position. So just looking at me sitting from the side, here is how most of us sit while we're driving. We're sitting slouched like this with our hands on the wheel, or you might do the one hand. Just depends how you drive. But here we go. Here's a two-handed on the wheel. Safe, more of a safe way to drive, right? Anyway, so yeah, sitting slouched like this, not good on the back. Puts a lot of pressure on the discs. Loads that spine improperly. It cannot take weight. But if we sit up straight like this, okay, and we activate these back muscles while we're sitting and stick our butt out a little bit so we sit onto our what's called sit bones, and I'll explain that a little bit more here later in this video. But anyway, if you're sitting like this, our backs are much more able to accept pressure and load down through them. They're more stable, and our discs don't have nearly as much pressure on them, and therefore we can drive for a long period of time. Now, I know that driving for a long period of time and sitting like that is tough. But the more you work at it, the better it get, and the more endurance you'll have in your back muscles. Our cars offer, to some varying degree, some type of lower back support built in that you can adjust and modify. But sometimes I've noticed just is not that effective. And then there's also external things and products you can buy to add to your car that you can strap around the seat. The one I would recommend the most is what's called the McKinsey roll. And if you guys need one of those, you can always hit me up for that. But that thing will keep your back in a better position. It'll keep the lordosis of your lower back, this inward curve, in the right position. Therefore, your back is going to be able to take that pressure. So there's a few products out there that can help. But developing that endurance and that strength in your back muscles and just knowing how to position your pelvis and your hips and your lower back is what's really going to be key. So let me show you guys what this looks like on the anatomy model. Okay, so one thing I want to point, or two structures I want to point out here when you're sitting, and how to sit and where to sit on them. So this here is the tailbone or coccyx, and this is here above it, as you call your sacrum. And this is going to go into your lower back here. Another thing here is called the sit bone or ischial tuberosity. So this is what we really want to be sitting on when we're sitting during those long car rides. A lot of people end up sitting just on their sacrum, and that's called sacral sitting. So if you look at it from the side here, okay, so here is sacral sitting like this. All the pressure is going right into that sacrum, okay? So, like that. But if you sit onto your sit bone, that ischial tuberosity, it's going to look like this. Here, the pelvis is going to tilt forward. This is going to restore this inward curve of the lower back called the lordosis. So here we go, coming from this slouch position up to this position. Okay, and then back to slouching, up to sitting, up correctly. So there you have it. So just really having that key awareness in the muscles of your spine and the structure of your spine is what's important. But there are some good exercises that I'll show you next that will help you improve that curvature in your lower back, improve the efficiency of your muscles, and therefore you can sit like that for a longer period of time. All right, so let me show you guys a few exercises here that you can do. The first one, you can get what's called a bolster. You can buy these on Amazon. You can use also a foam roller. Here's a foam roller. Or you can just roll up a towel. It's got to be rather thick though. So I'm going to be demonstrating with this bolster here. So I'm going to put the bolster right on my lumbar spine, lower back. And I'm going to bend my knees here. And then just lay flat while that bolster is in place. And then I can work on here, just kind of tilting my pelvis forward and arching my back over that bolster. So that will help restore a inward curve or lordosis of your lower back. Then we spend much of our life bending down, slouching down, so we want to go the opposite way. Now, this isn't true for everybody. Many times people have pain that radiates down their legs, and this may or may not help with that pain. If it makes it worse, you definitely want to stop doing this one and call me. and I can give you some more advice, maybe some other things you can do to improve your situation. But many of the times, this is helpful. So what you do is you lay flat on your stomach, and then what you want to do is keep your pelvis on the table or ground or bed, whatever surface you are on, and then you want to press up using your arms, hands on the floor like this, and then that's going to create a backward bend through your spine. Okay, you're going to try to hold that for about 5 seconds and then lower down. Now, many people might not be able to go up that far. You could start just on your using your forearms, and then just kind of work on pressing up like that. Don't let your waist come up though. You want to keep the pelvis. Keep the pelvis down. And then looking at like this too. Don't bring the pelvis up. Keep the pelvis down. This way you're just isolating movement to your spine, and especially into that lumbar spine, the lower back. And then go down. Okay? And then another one is you can do what's called a cat to camel. Cat to camel. Range of motion stretch exercise. You get onto your hands and knees here, and then you just work on sticking the butt back and letting your lower back sink down while you look up. Okay, and then just kind of return back to the middle. And then let it drop down again. And then return back to the middle. And then final exercise, you can do it either with a pillow underneath your waist here, or no pillow. Just go straight flat. Okay? And then you're trying to work on improving the strength of these muscles back here called the paraspinals. So what you do is you put your hands at your side like this, and then you work on trying to lift up your back off of the table, also trying to lift up your legs. So that's going to activate those back extensors, paraspinals, and also get your glute muscles. And then back down. And then up. Hold it for 10 seconds, 20 seconds, 30 seconds. The stronger you get, the longer you should be able to hold it. And that'll improve that endurance of those muscles. Okay? Another thing too, don't extend the head back like this. You want to make sure your chin is tucked in. Just retract the head up like this. There you go. And then back down. Okay, so here is one last exercise that you can do. It's called a squat with reach. So, looking from the side, here's how to do a squat incorrectly. That's just causing that bad form through the lower back. What you want to do is stick your butt out, get that inward curve of your lower back. And then I'm using 2 pounds here. You can go heavier, go lighter. Just depends on your ability at that point. So what you do from here is extend those weights out in front of you at about 45 degrees. Okay, and you just try to hold that. If you start to round like this, you just got to self-correct. What's often helpful too is maybe do these exercises in front of the mirror or in front of the video camera like what I'm doing here, and just give yourself something to look at to correct your form. If you see it starts to falter, you have that feedback and correct it. It's as simple as that. So one more time. Okay, we're squatting down, sticking the butt out, arching that lower back, and then extending the weight up. Okay, we're going to try to hold this for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and up. And just from doing this video, I've already have received a good workout. So if you guys spend the time and effort in doing those exercises, you will reap the rewards. you guys will feel better. Your back will feel better while driving or whatever you're doing throughout the day. And hopefully you won't have to come see me. But like I said, if you're having problems, if you continue to have back pain, even after doing these exercises, or if you just want some further advice and education, please come see me, make an appointment. I will be happy to help you and I will get you fixed. All right, guys, hope you enjoy. Bye.